Spicy MedTech here, and in this video, I will be discussing the different blood tubes and what they're for. Let's start with the Lavender Top Tube. This tube is laced with an additive called EDTA, and this additive keeps your blood from clotting. This tube is most commonly used for hematology tests. One of these tests is the complete blood count, or the CBC. This includes tests like the RBC count, which is important in investigating anemias and blood loss. Platelets, which when depleted can pose several bleeding risks. And the white blood cell count, which is typically increased in infection. It can also be used for other tests like glycated hemoglobin, or the HbA1c, which is important in the assessment of diabetic blood sugar control. The gold top tube, which contains a serum separator gel at the bottom, as you can see in the picture at the side, is used for a range of biochemistry tests, which includes serum electrolytes. This commonly gives value to ions like sodium, potassium, chloride, and ionized calcium. It can also be used in other blood chemistry tests like creatinine to monitor kidney function, urea to monitor conditions like azotemia, enzymes like ALT, AST, and GGT to monitor liver function, the lipid profile, which gives values to parameters like triglycerides and cholesterol. More tests include the C-reactive protein to detect inflammation, tumor markers to detect cancers and malignancies, for the detection of drugs in serum samples, and many other tests. The tests in the red top tube don't lie far from that of the gold top, since it also yields serum and can be used in both chemistry and serology testing. We call this the plain tube because of the absence of an additive. The blue top tube, or the citrate tube, is routinely used in hematology to assess the clotting system. The coagulation screen includes the prothrombin time, activated partial thromboplastin time, and fibrinogen. The INR is important for monitoring oral anticoagulant therapies like warfarin, and D-dimer, which is useful in monitoring deep vein thrombosis and pulmonary emboli. The gray top tube, which is laced with sodium fluoride, is mainly used to measure blood glucose, which can be both fasting and random samples, and can also measure lactate, which can increase in any condition causing tissue hypoperfusion, like sepsis and acute ischemia. Similar to the lavender top tube, the pink tube is laced with EDTA, but is commonly used in the blood bank for blood group analysis and cross-matching blood components with their recipients in blood transfusions. The green top tube, or the heparin tube, is laced with heparin, an anticoagulant produced naturally by our bodies, and is used in blood gas determination and other plasma chemistry tests. Lastly, we have the blood culture bottles. These bottles are used to isolate different organisms from a patient's blood. These bottles have different additives as to optimize isolation by having different growth requirements for different bacterial organisms. And that would be all for my guide on the different blood tubes used in the laboratory. Thanks for watching. I hope you enjoyed.